Hey, Dr. Bunio, how are you doing today?
I'm doing well, Chris. How are you?
I'm great. I'm great. Good opening here. I can't see much. I'm wearing my glasses today. They're real trendy right now, but with my mask, I really fog up. I know people at home are probably having that problem. So welcome everybody at home. We hope again that you share this out with your Facebook friends so that folks in the community can see what we're doing and what we're talking about today. Dr. Bunio and I are going to be discussing some COVID-19 updates as well as some other information for the community regarding our testing. And Dr. Bunio even brought in a really cool song while washing your hand exercise that we'll talk about toward the end. So welcome to the show. Dr. Bunio, have you had a busy week?
Yeah, it's been really busy, both at work and, just doing some projects around the house.
Oh, good.
It's just a lot happening right now.
Same. I'm growing out my hair. I think I'm going to start a grunge band right after we get done with this. We'll probably just put out, music videos. We won't do any live shows. We can't have the gatherings right now. I doubt we'll have a following, but it'll certainly be something to do.
You never know. Let me know.
May get famous from it. I don't know. Res famous. So we do have our drive-through testing happening. Today we've got 9 to 11, which has already happened, 1 to 3 p.m. So after we get off the air today, folks can go by the Drama parking lot there, the drive-through at the Drama, and get testing. We've had some really good numbers with this lately. We had a big turnout over the last few days, right?
Yeah, we had. They hit a record on Monday, 211 tests that were done. And I just want to give a shout out to the people that are working those tents. It's getting hot. They have to wear all that protective, that PPE.
Right.
It's really tough. So if you do go get testing, thank them.
Oh, that's good.
It's really a lot that they're doing for this community.
Good. So we'll get our testing done today again from 1 to 3. Friday we're back at it 9 to 3. There's a lunch break from 11 to 1 there. So if you don't catch them today, please go by Friday 9 to 3. It's very important right now, and we can kind of get into this just in the front of this, Dr. Bunio, because it could be kind of the trend we talk about throughout the day. There are other Native American tribes right now that are really being impacted by COVID-19. From the Navajo Nation, I've seen a lot of reports down in the Seminole tribe of Florida have had some deaths and some infections. But something that we really relate to here in Cherokee, we play football against them, and we consider them, brothers and sisters just right close by. The Choctaw tribe of Mississippi, they've really been hit hard. I know that they have a similar amount of enrolled members or population as we do, rural like we are, and they have almost over 700 cases right now confirmed, and over 40 deaths. Why is it important right now more than ever that a tribe like ours come together and really pay attention to the severity of this issue at hand?
Well, I think it's really important because of some things we've mentioned before is that this thing can get out of hand very quickly.
Right.
And before we know it, that could be us. We've been fortunate. Some of the measures taken by leadership and the work done by all the people up at the hospital, we've been able to hold the virus off.
Right.
But it wouldn't take much for us to be like Choctaw and our health system and our community get overwhelmed. So we cannot relax our vigilance right now.
That's right. So for the public out there, just keep them in your thoughts. All the folks that are affected by this right now, and there's a lot going on in the world. But it is our time, and we're doing our part. We're actually in a really good place right now. We've got to continue to stay diligent with this, get our testing done, track this thing down, pin it in a corner, and keep it out of here. We are a tribe. We like to be together. We're very social. But it's very important that we mitigate this as much as we can, as long as we can. What are we trying to get to at this point?
Well, like you said, we really want to hold off the virus until, some of the work that's being done and the vaccine development can get done. If we can get a vaccine or we can get further on with any sort of treatments that are proven to be more effective, I think we could relax a little bit. Right now, I don't think we can relax yet.
Right.
So that's why it's just even more important.
If anything, with the economy opening up, more folks coming to our neighborhood, I know that we've loosened up as a public, it's more important now than ever that we follow what's being designated the 3 W's.
Right.
You want to walk through the 3 W's? Do we have? There we go. What are the 3 W's?
It's actually up there, and this came, the 3 W's. We got that mnemonic from the state, and that's wear, which is wear your mask. Wait, which is try to wait and leave that 6 foot social distance between you and other people that are not part of your household. And wash, which is wash your hands.
Right.
And of course, you're using hand sanitizer also.
Good. And you're going to see more. We're putting this messaging out in the community, so you're going to see more and more of this as a reminder. This isn't a diet. This is a lifestyle change. This is something we have to take seriously. It's hard, as anything is that involves change or that goes against our comfort. Wearing the mask out in this hot sun right now is difficult, but always try to keep in the back of your mind the things that we've talked about. This thing's spreading. It's hit hard in Native communities. And we have to do our part to be vigilant with this and to stay aware of what our part in this is. We all have a personal responsibility in this, and to try to not be that one person that passes that on should we catch it. And it's out there. It's just like anything else. We're going to come in contact with it. Try to do our part to mitigate that as much as possible, and to help each other, not to shame each other, but to help each other if it does hit your neighborhood. But to quarantine and to do your part with the 3 W's. So,
yeah, I agree with all that. And the majority of the people that we've identified that have the virus, a lot of them didn't know they had it. They're not trying to infect other people. Sometimes they weren't following the safe practices, and so that's unfortunate. But we're trying to just make sure that we stop the spread. If somebody has it, we want to contain it. We don't want it to get out, and we don't want to get like Choctaw or Navajo Nation have gotten to.
Right. So with that being said, and I know I'm way ahead of our questions here, but is testing available this week?
Yeah.
So we already mentioned the dates on that.
The schedule.
Today at 1 to 3, Friday 9 to 3.
Yep.
So make sure you guys get up and get tested. We're still looking at like a frequency. If you haven't been tested in a couple of weeks, send someone from your home to be tested. I think that's a good recommendation at this point. Is that right?
Yeah, and even more importantly, if you have any symptoms, if you're just feeling unwell, if you have a fever, if you're coughing, even sneezing, go ahead and get tested. I mean, hopefully you don't have the virus.
Right.
Hopefully it's just allergies or something else. But you can't know unless you get the test.
That's right. Do we have a percentage at this point? I don't mean to spring this on you, but of the folks that are coming in asymptomatic versus with minor symptoms?
We're looking at that. We don't capture that completely, but so I can't compare one to the other.
Right.
But what I can tell you is that we feel that those who are symptomatic have a higher percentage of those are gonna have the virus and test positive.
Okay.
Again, the problem is that pre-symptomatic period. 2 days before you start showing symptoms, we think that you are potentially spreading the virus,
Gotcha.
which is why wearing the masks. Always important.
Help protect each other, one another.
Yep.
I had trouble getting through the COVID hotline earlier this week. What was that issue?
Well, as I alluded to, they hit a record number of tests on Monday. We experienced a huge increase in the number of calls, and that was related to some increase in disease activity.
Gotcha.
So a lot of people were worried. A lot of people wanted to get through to the hotline, and we just were unable to staff it at such short notice. So we've taken steps to get more people staffing the hotline. We want to we'd like you to call ahead. If we get a lot of people that are driving up, we are not going to turn anybody away, but it means longer lines. I think anybody that showed up on Monday who didn't have an appointment, and even some that did, realized that they had to wait quite a long time.
Right.
If you call ahead, we can kind of tell you what's a good time to come in and get you in and out as quickly as possible.
Okay, good. So those issues are being fixed up. A lot of it's technical and then having staffing there. So
yeah,
that's good. Well, I'm glad the public is concerned, and again, we're going to be there. Hit us on Facebook, call the hotline. We will eventually get back to you and make sure that we're answering your concerns and questions. With the increase in positives, has the hospital been able to pinpoint the source of the community spread at this point?
So, as we talked about last time, community spread means, by definition, you don't know where people got it from. We currently have, we've had 48, I believe it was 48 positives.
Okay, yep.
32 of those cases are still active. So it is an increase. Now, some of those we can trace back to a person, but at the top of each of those
The hierarchy of
hierarchy or trees or lineage, whatever you want to call it, there's a person who got it and we don't know where they got it from.
Gotcha.
So we are seeing community spread. What that means is it's out there in the community and we cannot tie it back to any one place or person. We have seen some little mini surges in some events where people have gone to and not practiced masking or social distancing. And we are seeing a fair number of cases that are just within a household.
Gotcha.
Once one person gets it, it's pretty hard for other people in the household not to get it.
Gotcha.
So the best protection is not catch it in the first place.
Right.
And that's how we're going to protect the community.
And again, it goes back to the assumption that we just have to assume it's everywhere.
Yeah.
At this point, protect ourselves, protect others by assuming that we have it, assuming that other people have it, that surfaces have it, and just wipe down our surfaces, wash our hands, wear our masks, and keep apart for just the next bit.
Yeah, I think what they're coming out with now is droplet spread or inhaling it is probably one of the more common ways to catch it. Contact is still there, but now we also feel that eye protection is another very important thing to do. So you got your glasses on, so that's good.
Yeah.
But some eye protection is also thought to protect people.
Good. Okay. The World Health Organization recently released a conflicting statement, on the spread of the rate of asymptomatic cases. So is it very rare that a silent carrier can spread the virus? I'm really confused with some of that statement. I know this comes from the community, so let's clarify what we are saying to our public here.
So that's a great question, and it was confusing, and the World Health Organization has already retracted that statement. Right. It is not rare for a silent carrier to spread the virus. We know that happens, and as soon as they released it, they got pushback from the entire scientific community. So that was a mistake on their part. I think it was appropriate for the scientific community to push back and say, hey, listen, we've got evidence that you can be asymptomatic and you are spreading it. I think it was just a little bit of confusion on their part of how they defined asymptomatic. And, I don't want to get into the details of it, but basically, who are you going to trust? Well, trust Chris and me.
I stayed at a Holiday Inn Express last night. I don't know about you, Dr. Bunio, but I feel good today. Like I know what I'm talking about. Yeah,
and this is something that I think we've seen before, where this information is coming out so fast. We got to be really careful about who we believe and which bandwagon we're going to jump on, because we've seen things come out that people thought the hydroxychloroquine, we thought that was going to save everybody. Well, it didn't.
Right.
So. We want an answer right away, but we're going to have to be patient so that we get the right answer.
Right, and I want to speak to that in a sense here too with our community.
Yeah,
there is sometimes misinformation out there, and it's not pointing fingers, but some folks just have the wrong information, or they've been given the wrong information from one another. Our Facebook pages, our hotline phone numbers. Me personally, if you have me on as a friend on Facebook, or if you don't, add me. If you have a question or a concern, if you heard something and you want some clarification before you publicly say it or start telling other friends and family, please reach out to us and get the correct information. It's so important right now, especially as we're hitting new numbers and we're seeing new cases of this and we're seeing new things coming out in the public and in the media, that you get the information from the sources like us that we can clarify. And we're not always going to be perfect, but we're going to try to give you the best information, the most accurate information, and what we can tell you. And so please, as a community, make sure that as we share information, that we're sharing the same information, that it is the accurate information. We're not going to withhold or hide anything from anybody. That's not our role. But we certainly want to make sure that we're telling you what we know and that keep you safe and keep the community safe as it comes out. That's just a small tidbit we deal with sometimes in the PR world. And so I want to participate in upcoming protests and rallies. This is happening right now.
Yeah.
What should I do to protect myself in a large crowd?
Well, same thing. Wear a mask.
Yep.
Try to practice social distancing. I know that's with some of these large rallies, that's almost impossible.
It's tricky, yes.
And practice really good hand hygiene. Have some hand sanitizer, wash your hands. The masking is probably the most important. Some form of eye protection's, a good idea too. And I mean, I understand. I mean, this is a very turbulent time,
Right.
and people just want to do something. But the only 100% safe way is to not go,
Right.
because, we want people to stay home and not be in large groups. But if you feel compelled and you have to go, wear your mask. Try to keep your distance from other people and wash your hands.
Well, luckily, I'm hearing some news now that there are things happening in the world in regards to this. People are being heard, policies are being addressed, laws are being looked at, and so we have done our part. A lot of folks have done their part, whether through web or in person in these protests. So hopefully this stuff the changes that they need start to happen, and that we can not have to address this as often with the public gatherings. But certainly, if you go and you want to exercise your right, which everyone has, please do it as safely as you can.
Yep.
And that's the message we can give our community. Do it as safely as you can. Come home, watch yourself, wash your hands, clean things, and just see how things go for a few days, and then we should be good to go.
Yep.
Good. Well, hey, I wanted to talk real quickly, though, about your... I know we've been real serious, so I know it looks like you bleached your mask. Is that what happened?
Yeah, well, this is just the mask that came up in the rotation today.
Oh,
but,
you got a rotation now.
Yeah.
I like it.
Yeah, I got to wash them in between. So
Gotcha. I have a few others, but I really like this one on air. I tie it up. It stays on really good.
It's your brand.
I think it's my brand at this point.
Yeah.
Thanks, Christy, for making that for me. But on a serious note again, excuse me, we've talked about now what it's doing to Native communities. We've talked about how it's surging in some states around us. I think they talked about 21 states have more cases now than they had before. It's increasing. So there is an answer. We've identified a lot of the problem, right? We say, look, it's out there. Wear your mask. Here's some precautionary things. There is some form of kind of an answer we'd like to kind of put out there, or a challenge, or some kind that can show decreasing numbers. Is that correct?
Well, yeah. I mean, I think we're actually doing a good job, but this is the kind of fight where you don't know if you're really winning until it's like 2 weeks later.
Right.
So. We want to see that the numbers are leveling off. Right now, we're seeing a little bit of an increase. That's worrisome. You remember when we did that exercise where we doubled, a penny every day, and before you know it, you've got $10 million.
Correct.
Well,
which I haven't done, by the way. Okay. I'm still broke.
Yeah. So what we want to do is we just want to keep an eye on this. We want people to, just follow this advice, and we want to see those curves leveling off.
Right.
And when we do that, I wish I could say then you could relax, but you can't. We're really trying to buy time here. We're trying to buy time until there's a vaccine, there's more effective treatments. Once that happens, then I think things will get back to whatever the new normal is going to be.
Correct. So is there a model out there that talks about slowing the spread of COVID by a percentage of the population that wear masks?
Yeah, there are a lot of models. So a model basically takes a number of different factors and it changes them and tries to predict the future. None of them are perfect, but so it's kind of like when you see a hurricane's coming and you see all those little different lines trying to predict where it's going to hit. Well, as it gets closer and closer, the models get a little bit more accurate. But there was one model that I looked at, and I felt that this was a really good guideline. It said if any population that can get to 70 to 80% of mask wearing while out in public can decrease the spread of the virus.
It can actually start the downhill trend of the virus.
Yeah, we talked about that R value. It's like if you get the virus, how many people are you going to infect?
Correct.
Well, the average right now is about 2.5.
Okay.
And I did a quick calculation before I came here based on our positive cases. We're about that, probably a little bit higher right now than 2. And you got to get that number down below 1. So if on average, a person that has the virus can only give it to 1 or fewer people, actually fewer than 1.
If you get it fewer than 1, then essentially
it's going to gradually go down. Yeah. The virus, it can live on surfaces for, we talked about up to 3 days. The virus can't survive outside of our bodies. We know it's in bats, but hopefully we're staying away from bats.
Yeah.
And so
I'm going to talk to Mike Lavoie about that.
Yeah,
or
please
bats.
do. So the virus needs us to replicate and survive. It's like somebody went into a factory and just told it to stop making cars and start making, something else, umbrellas. But in this case, the virus comes in, it takes over the machinery of our body, and it makes us produce more viruses.
I got you.
And that's how
more umbrellas.
Yeah. And so if we can stop giving the virus a place to produce more of itself, it's going to die off.
Gotcha. And so wearing the mask, we've stopped it. We've held it, contained it to inside of us. We've reduced the R value to below 1, which means we're not spreading it to anyone.
Yeah.
And that's a way, as a population, and you've seen the number again, 70 to 80%. So if 7 out of 10 of us or 8 out of 10 of us that are out here will wear our masks and deal with that just for a few more months, we can actually start to decline the numbers of infections.
Yeah.
Okay.
Yeah, that's the model.
So that's the model. That's kind of an answer, and that's kind of a fix. That's why I'm sure people are sick of us saying, put your mask on, but that's kind of why we're saying it, is that's one of the few ways we know at this point that, through math and through studies and research, that we can reduce this number of infections and actually stamp this thing out in our community. Good, okay. And so folks out there in the community, some of them have not taken this as seriously, I'm sure. What do we say to folks that have the mentality of like, if I get it, I get it, I'm just going to go live my life kind of thing? Like, what can we say to that?
Well, I think we would say that it's not just you. If you get it, and particularly if you're really healthy and you don't even know you have it, let's say you have very mild symptoms or no symptoms. If you're not wearing if you get it and you're wearing your mask and you don't give it to anybody else, okay, you've done your part.
Right.
But the problem is when you get it, you can give it to young children, to elders.
Okay.
You can give it to people who have a much higher mortality rate. We've got people now that we have had to admit. Usually we're actually sending them to Mission or Harris Regional because, they need ICU care. So we have people right now from this community that have gotten very, very sick. So if it was just you, I could see that being a personal decision, but it's not just you.
It affects the people around us and the community at large.
Yeah.
You had discovered a really fun way when we're talking about washing hands. On the internet here, you've used technology. I'm so proud of you.
Yeah.
I know you're not a big social media person. What do you have, like tens of friends?
Well, you mean in real life? Yeah, no, I have a couple.
Okay.
Sure. Hi to my 2 friends.
2 or 3 friends out there watching.
And my family.
Hopefully they've shared, so we'll have 3 or 4 shares.
But yeah, I found this site. I was just there's something called the internet. I discovered it the other day, and there's a website called Wash Your Lyrics. So what you can do with this is you can, and I don't know if the camera will pick this up, but you can put in any song, and it will give you little pictures about how to wash your hands and put the lyrics underneath it, so that you can follow along. You can put this up, right over your sink. You've got the one I did for Staying Alive. And I did one for the Dwarves Washing Song from Snow White.
That's exciting.
This one is a little more child-friendly. If you want to encourage your kids to wash their hands, they might, find this a little bit more fun.
I think it's fun. You get the lyrics right there for each part that you should be doing. So, and now it's all right. It's okay. I should be having my fingers interlocked like this. And you may look the other way. I haven't actually done this movement, but it says to do this. I don't know what that is, but
you want to get that one. Yeah, you want to get your fingernails under your fingernails. You also want to wash the backs of your hands. That's another one that people don't do a lot.
How about this one?
Your thumb. You just want to make sure. We
can try to understand the New York Times effect on man. I mean, this sounds political, Dr. Bunio. I don't know if we can go into this one.
I tried to pick something. I went with a Walt Disney one here, so.
Yeah.
It's fun. It's called washyourlyrics.com, and I think it's just like this. Actually, I think it was invented by some young man, a teenager who
How fun!
Yeah, so I thought it was kind of fun, something people could do.
That's cool. So hey, get your kids out there. Print them out some lyrics to some of their favorite childhood songs, Disney songs, hopefully, not the Bee Gees political song here, but
Yeah.
no, this is a good song. And yeah, put it in the bathroom. So let your kids sing a song for a couple days, swap it out, have a couple of songs. It's a good way to practice good hygiene. It's fun, and they can learn the lyrics. There's a lot of songs I try to sing in the shower, and I don't know all the lyrics, but I make them up as I go, and I should put some of those on there.
Okay.
Again, we've got our testing today, 1 to 3. We've got testing Friday, 9 to 3. Call the hotline, 497-3743. We'll post it on the blurb today. And just make sure that you're doing your part. And that's all we're asking. Just put your mask on, keep your social distance, wash your hands, take care of yourselves, take care of your family, take care of our community. We're in this together. Dr. Bunio, you and your team, thank you so much for all the work that the hospital's doing. Thank you to all the frontline workers out there. I know that a lot of folks don't get enough thanks for all the hard work they're doing, and they're putting themselves out there. The casino staff out there who are getting that machine rolling again. You know, to the folks staying at home and doing your part, thank you. To the folks who are on the edge about it, just listen to us. Try to do your part. We're a community, we're a tribe for a reason. We've stuck together for all these thousands of years. We've got to continue to try to push this lifestyle change out just for the next little bit to mitigate this, to get us to a point where hopefully we can have some kind of a normal life again one day. But until then, it's just so important that we practice good, safe habits together. And if you have any questions at all, please don't hesitate to reach out to Dr. Bunio's staff, to the hospital, to me personally, whoever you need to speak with, the chief, and ask us the questions. Let's get the right information out and really encourage each other to do your part. So thank you again. We'll see you again very soon. Data Dog, I'll you.